Coming up, how we can protect our mental health during difficult times. I need help, and I bet I'm not alone. Activate Live starts now.
Activate your voice! Activa tu voz! Activate it now!
Speak up, speak out.
Get involved, get involved.
Engage-toi!
Take action.
Aktiviere deine Stimme.
We're union and we're proud.
Welcome to Activate Live. I'm Tanya Hutchins from the Machinists Union, coming to you from Washington, D.C. We'll get to our interview and what everything that's happening around us is doing to our state of mind in just a moment. But first, here's what's happening in labor news. The IAM and NEFI have joined a coalition of federal unions that wrote to the president Monday regarding the government's response to COVID-19 and its responsibilities to civil servants. The Federal Workers Alliance is asking the government to prioritize safety and security amid the country's reopening. The alliance listed 11 demands, among them accommodations for employees with pre-existing conditions, personal protective equipment, on-demand testing for those who suspect they've been exposed to COVID-19, and sanitizing stations. Well, if you're a Machinist Union member, IAM-Crest is conducting a survey to gather information about employers' responses to the pandemic. And this is the page. You can find it on the IAM-Crest Facebook page. We'll also post it in comments on this video. Responses are due by June 30th, so please take part. The AFL-CIO and other labor organizations and allies have postponed a car caravan that was supposed to happen in Washington, D.C. today. Union members have been calling senators to demand they support the HEROES Act, a crucial proposed COVID-19 economic and social relief bill. We'll let you know when a new date is scheduled. Very important bill there. Well, the past 2 months have been extremely stressful for so many people, dealing with layoffs, furloughs, unexpected homeschooling, and cabin fever. June is Men's Mental Health Month, and the majority of our members in the Machinist Union are men. But this month, almost everyone is under stress after the death of George Floyd, protests on his behalf, and that of Black people who have died at the hands or knees of police. We are under stress from our communities being vandalized or burned down. IAM International President Bob Martinez addressed our concerns in a message to members, stating the IAM has long recognized the inherent worth of dignity of every person. We have sought to make that principle real both in the workplace and in the community. George Floyd's death and the generations of injustices that have preceded what we are facing today show in plain sight that we have fallen short of our nation's promise. We have a lot of work yet to be done. Now, you can see the full statement on goiam.org and in iMail. Now, the AFL-CIO headquarters in Washington, D.C. was broken into, and the lobby was actually set on fire. Now, these photos were taken Monday by Communications Representative John Lett. Richard Trumka tweeted almost immediately, and he said, "We will clean up the glass, we'll sweep away the ashes, and keep doing our part to bring a better day out of this hour of darkness and despair." Now, here's a tweet by Will Attig of the Union Veterans Council saying, "This is a building, not a movement. We will go to work as always to make this world a better and more fair place. We will not be silent." And this is a photo from our union members in Long Beach, California, in front of a sign that says, "In solidarity, our union demands justice. Black Lives Matter." It's wonderful to see so much positive support. I'm trying to look there. I see Natalie Gonzalez in the front of that photo. So we do see support everywhere. Support is so important. And if you're watching, please let us know how you're doing and if you're okay. We're partnering with the American Foundation for Suicide Prevention to bring you the tools that you need to stay mentally healthy. And joining us now is the Chief Medical Officer of AFSP, Christine Moutier. Thank you so much for joining us, Christine.
Thank you, Tanya, for having me. It's really my honor to have the opportunity to speak with your members.
Well, first off, so we can learn a little bit about you, you're a psychiatrist. Can you tell us the difference between what you do and what a psychologist does?
Sure. Psychiatrists and psychologists are both mental health professionals, but psychiatrists go to medical school and are medically trained as physicians, first and foremost, and then specialize in mental health concerns of the brain and the mind and in our lives, we're going to talk about. And psychologists do not go to medical school, they go to graduate school. And so they do a whole variety of things like therapy and neuropsychological testing. Our professions, our disciplines oftentimes work together. And so if you are wondering, like, who should you see for a mental health condition, you can actually start with either one, a psychiatrist or a psychologist. If in the end you need to be prescribed a medication, that would be by a psychiatrist. So sometimes people will just start with the psychiatrist if they think that it's going to go down a path to considering a medication.
Thank you for clarifying that. Do you think that most people in general pay enough attention to their mental health?
Well, I think times are changing, and while we might not all use the language to call it our mental health, I think especially right now during COVID and also with the civil unrest that's happening, we're focused on how are we coping, thriving, staying up with our work, with our families. Are we getting the sleep we need? Are we able to concentrate? I mean, all of those things stem from our mental health, which so I think it's on people's minds. And really, you know, the day when we couldn't talk about how we're doing from the inside, our experience internally, that day really is over, but that doesn't, we're still learning how to do that for each other. And that's why this conversation is so terrific.
Now, you mentioned a big thing for me, sleep. You know, I've had insomnia for years, and when we have stresses like what's going on now with the national unrest, you know, it could even get worse. But how much a difference can it make if we do maintain our mental health and just keep it in check?
You know, the way I look at it for myself, my loved ones, everyone, is that everything you do in your life, whether it's in your relationships at home, your roles at work, it all is laying on the foundational bed of having a sound mind, having yourself in all the resources that you have in your optimal state of physical and mental health, kind of bringing those to bear. So it is, to me, it's just so critical. And when I start noticing that things are kind of fraying at the seams, either just the stress load is higher, you know, we're having to adapt during COVID and so many unknowns, or if I notice that my sleep, which everyone has like the first heralding indicator that things are starting to kind of fray at the seams a little bit, those are the times when we can absolutely take a step back and make a difference for ourselves, even just making decisions in our own life choices, let alone potentially with the help of a mental health professional if it needs to be at that level.
Now, you mentioned the word indicator. We often have a general idea of what stresses us, but how can we better identify certain stressors?
I think if you look back at your life and think about what are the first things that either you or your spouse or somebody who's close to you notice when stress is high. For some people, sleep is the first thing, and it can be that you have trouble falling asleep, or it can be that you have trouble staying asleep, or that you start waking up too early in the morning at like 3, 4, or 5 a.m. And can't get back to sleep. For other people, it's that your frustration tolerance narrows down to like nothing, and you start getting irritable and losing your temper more quickly. And so knowing yourself is a way to answer that question. But I've just pulled out 2 of the most common kind of heralding signs that would indicate that stress is getting to us, and that we can do some take some steps to make our mental health a little bit more solid, to kind of fill up our resilience tank even fuller.
What are some of the danger signs that we can look for when we're seeing relatives or friends under stress? Are there some of those same things that you just talked about?
Yes, and of course, we may not even know if somebody's sleep is changing, but we see what we see of other people from our perspective, it's really from the outside view, is it can tell us a lot. So their usual behavior patterns that people have, I mean, like we tend to think of ourselves as like having, we're people of free will, and that is true. We have a mind, we make choices. But when it comes to issues of health and even mental health, we're fairly predictable and things stay within a narrow range. So when your radar goes off telling you that they don't see themselves, they're showing up late now when they're always somebody who's like really on time, or they are always somebody who shows a lot of kindness and patience and now they're losing their temper, those are all subtle but possibly real indicators that their mental health is deteriorating, and you could actually be a source of support and help to them just by engaging them in a caring conversation about how they're doing and just listening to them.
Now, you just mentioned one of the coping strategies there. I was going to ask you, what coping strategies exist. What other ones, what else can we do to help, even ourselves?
Yes. Well, okay. So there are a few kind of like basics that I think just are common to us as human beings. We just do better, thrive better, and keep our resilience high when we are doing these things. And they are making sure that our sleep is protected and that our rest is being kind of optimized, that we're getting good enough nutrition, that we're hydrating well enough. I mean, these are such obvious basics, but they're fundamental for a reason, because when we forget or things get in the way, then our health starts to deteriorate. It has that rapid an effect. And the other things that are kind of like necessary basics that we might not think about as much are limiting our alcohol intake, having some structure to every single day, even if we are off work, even if we're on vacation, actually having a couple of goals on our list or a couple of things that we organize our day around. It can be very, very simple things, but having some structure. And then the last thing is staying connected with the people and the activities that you know from your experiences in the past are those people or activities that keep you the most grounded and centered. That version of you can be emphasized by actually making choices to engage with those people and with those activities.
We just saw some words up on the screen, like stress and anxiety and depression. What is the difference, clinically between anxiety and depression?
Yeah, it's a really good question. And many people who experience depression or who experience anxiety have a tremendous overlap, actually. So one way to think of it, though, is that depression with a big D, like the clinical depression that is actually a medical illness, is primarily characterized by problems with your mood, your energy, feeling like not connected, not interested in the usual things, and really feeling a sense of either hopelessness or feeling trapped. Those are all feelings of depression. Isolating yourself, withdrawing, those are typical. But and for men and many women, it is also that anger and irritability can become the primary kind of symptom of depression, or at least the symptom that people notice the most. Now, when it comes to anxiety, that as an illness is primarily characterized by body tension, a lot of physical symptoms, actually with both, but with anxiety, it's a tense feeling. You can have back pain, headaches, sexual problems, and what tends to be happening in the person's mind is a real focus on what can go wrong and worries that just don't lead to a constructive problem solving, but just keep cycling around and feeling like there is no solution. And there are different types of anxiety, actually. There's a kind that is just overall excessive worry that also plants itself firmly in the physiology of your body. So you feel tense and it interrupts your sleep. And there are other kinds of anxiety that produce things like panic attacks or very specific fears of like social phobia. That's another fairly common anxiety disorder where it is fear of humiliation and rejection, and so that you almost feel paralyzed when you're in a situation where you need to talk to a boss or talk to someone of the opposite sex. It's usually fairly like specific how a person's social anxiety plays itself out. PTSD, post-traumatic stress, is another type of disorder that is that's sort of related to anxiety, that really is also in the body, disrupts sleep, is about feeling hyper vigilant, and it's like your whole nervous system is up on overdrive, and it makes all of your bodily functions and sleep and your ability to problem solve and be present and relaxed, it disrupts all of that.
So we have an EAP program, the Employee Assistance Program. We also have IAM addiction services. How important is the role of an EAP program, especially not only at a company, but at a union like ours? We have our own.
Yes, sometimes they are the least sort of known about, and can be the most helpful or the most really accessible thing to consider contacting. If you're somebody who is not as familiar with mental health services, your EAP, as well as those addiction services, if it is substances that is your main concern, those are very confidential and very expert resources to connect with. And I think one of the barriers that keeps people from doing that is, number one, they just may not know about it. So I appreciate that we're highlighting that now. But number two, they might think that because it is provided by the employer, that there is no confidentiality, or that privacy is being compromised. And that is not the case. Any health issue and seeking care from an employee assistance program, those are protected health information records, just like if you go to your primary care doctor or you see any type of doctor, using your insurance. Those are protected records. That information does not get back to your employer. In fact, they will not know the names of people who go. They will only receive information in terms of like aggregate data, I mean the number of people who sought the number of sessions, but not private health information. So it's really an excellent place to start the conversation and maybe even figure out what you or what your family member might need, in addition to the several meetings that you can have for free with your EAP.
So I have a two-part question. I was going to ask you what other resources are out there for people, but I would think that your organization is a resource as well. So tell us a little bit about the American Foundation for Suicide Prevention.
Thank you. Yes. At AFSP, we have lots of information and resources that relate to anything from the mental health of your loved ones, when to be concerned, how to connect with somebody who might have a similar experience, and particularly, we are certainly interested in preventing suicide. Part of our work involves providing support to those who have been touched by suicide already, meaning you've lost someone to suicide or you have survived your own suicide attempt. Those are all people who are involved with us. We have chapters in all 50 states. And so please go to afsp.org if you're interested in learning more about any of this. Now, if you find yourself in a crisis moment or a loved one is in crisis, then the resources are actually different. They are the National Suicide Prevention Lifeline, where you can call, again, for yourself or for a loved one, or even just a peer that you're trying to help, but you're not sure what to do next. And that is 1-800-273-TALK. And then the crisis text line is the other national resource that you can reach out to 24/7 for a trained counselor to help provide you or a loved one guidance. And that would be by texting the word TALK to 741-741.
Okay, we'll put all of this in comments as well. And speaking of comments, we have one from Lane Johnston asking, what would be the difference between depression and just feeling down for a few days?
Right. And it's a really good question, because just like our physical health, our mental health and our mood has a natural kind of ebb and flow to it that does not necessarily meet the definition of a disorder or an illness. But I think if you're finding that your mood is down, in whatever way that that's playing out for you, and it's not bouncing back to your usual baseline within a week or two, then I would start looking at other things like, how is your sleep? How is your ability to concentrate? Are you able to be present in your work and in your relationships at home? Are you starting to have overwhelming feelings of hopelessness, or feeling like things can never change, that you're trapped or like you're a burden? Those would all be signs that you absolutely should seek a professional opinion and see what can be done. There are many forms of support and treatment that we all should explore and access at different times. I myself, as a working professional, have availed myself of therapy numerous different times in my life, not necessarily because it has turned out into a big D depression or a big A anxiety disorder, but because I wanted to be sure to stay on the side of optimizing my mental health. And so therapy and treatment can serve both purposes of actually addressing significant serious illness that's impeding your health and your functioning, but it can also be that you can use it almost more like an elite athlete would use a coach, to really up your game and optimize things when it comes to your mental health.
There's a stigma out there. How do we get over the stigma of asking for help? And Zita, her question is perfect as I'm asking this, because she's saying stigmas are changing. It's easier to talk about now. Thank you for that comment, Zita. But, for the people who aren't ready yet and are having trouble asking for help, what advice do you have for them?
Yeah, I think for you to know that if you still are in that mode of that you feel like it would bring a certain vulnerability to yourself by even opening up the door to talk about what it is you're going through, just realize that these are conversations that are now being had in workplaces across every industry, among athletes and celebrities and musicians. So if that helps you at all to know that, first of all, you're not alone in whatever it is you are experiencing, it should not be a sign of weakness or have any element of embarrassment or shame. These are human experiences with mental health. And I know sometimes if you haven't met yet with a therapist, a psychologist, or a psychiatrist, it can really feel like you just don't know what to expect and you don't even really want to go down that road. So that becomes a barrier as well. Just realize that it's going to be a conversation with a trained professional. I'm a psychiatrist, and when a patient comes in, mostly I want to learn and hear from them about what they're going through, and help guide that conversation. And then at the end of the assessment, which usually takes between like an hour to 90 minutes, sometimes over a couple of meetings, but usually in that first meeting, then I will provide my thoughts about what the most likely scenarios are in terms of what is driving the symptoms and the distress, and go over some options for strategies to take. And they can include everything from treatment options to different things that can be tried at home in your own, in your own self-care and within your own family. So it is simply a conversation like that. Sometimes if you have medical problems like hypertension, heart disease, COPD, or a thyroid condition, then we also just want to make sure that those medical conditions aren't contributing to your mental health, because the brain and the body are 100% connected. So that is also, by the way, the benefit of seeing a trained professional is that you'll gain a better sense of, it's true that some medications for hypertension and certain illnesses like hypothyroidism on their own can lead to symptoms of depression or anxiety. And so a medical professional or a mental health professional can help you to sort all of that out.
Does it get easier for the people that do seek help and they're working on it? What do you hear? What kind of feedback do you hear?
Yes, what I have seen and actually experienced myself is that there is this incredible growth curve that happens with starting to pay attention to your mental health that allows you to first and foremost open that door and kind of figure out what is safe, who is safe to talk to about it, of the language to use. You can start learning more about what are your own triggers for spiraling down, and what are those people and activities that really ground you and build up your mental health. And so it can be a process over time that reaps great rewards and has some other kind of unanticipated benefits too. Like, I think one of them is that when you start working on your mental health, then your relationships also get the benefit of this healthier version of you, where you're able to hear them more. You can take the conversations a bit deeper in our relationships and connect more. And there is also this sense of freedom that comes with being able to live more authentically, whether it is something, a secret that you've been keeping from the past, whether it is addiction struggles or mental health experiences. Bringing all of those into the light is a way to find freedom at a much deeper level.
You mentioned a process, that it can be a process. So this sounds like nothing is fixed overnight. There's certain people, like somebody said to me yesterday, I was kind of down and I got sick of watching the news and I had to turn it off, but they said, oh, I hope you feel better tomorrow. It doesn't sound like this is something that can be solved overnight. Am I right?
Well, I think it depends. I think what you just mentioned, limiting media intake right now can be important because while it's important that we connect with what's going on and learn more and raise our voices where we feel compelled to, it's also important that we're monitoring the potential negative impact that it can have on us when media is just so intense, and some sources of media too can be a little sensationalized, so I think that's a matter of just learning again. Watch yourself and what is the impact that it's having on you. And for many of us, when we make that decision to limit media and just turn it off for the day, or to get to bed a little bit earlier, it might actually reboot us so that we wake up the next day feeling quite refreshed and overall better. But for other issues, it is much more of a long-term journey and process to find those solutions and to reach a different level of coping and thriving.
You've given us so much wonderful information. Is there anything else you'd like to mention? Wait, hold on. We got another comment from Annabelle Dean Howard. She says some of the signs that include tiredness, lack of motivation, overeating, not eating. Depression doesn't mean sadness all the time. So she was sharing her view there. Is that something that you've also heard or deal with?
Oh, yes, absolutely. I mean, I think depression is oftentimes really misunderstood to be just a mood issue in your feeling state. But the truth is, just like she pointed out, depression and anxiety actually show up in all of these ways that affect our body, our day-to-day kind of experiences of life, just like she's saying. So it really just highlights how important it is to allow yourself to take that step to learn more about mental health and about how you can use some strategies to see where that can take you.
Well, thank you so much for joining us, taking the time out of your schedule. We really appreciate it. You've given us a lot to think about and some coping strategies. So thank you very much. That was Dr. Christine Moutier of the American Foundation for Suicide Prevention. And don't forget, the Machinists Union has resources available on the IAM Employee Assistance Program page. So all you have to do is go to goiam.org, click on resources, and you can find information like our national helpline here. We have our own EAP program with a national helpline where someone will answer the call. There are lots of resources listed on this page. Now, you can also go to, we have IAM Addiction Services there, 888-250-4IAM, and that has assistance 24 hours a day. You can pick up the phone and talk to someone right away. And I think that Vinny Sarasso answers that phone. We've had Vinny on our show before. The AFL-CIO, if you go to aflcio.org, you can see resources for your individual state on a map, and you can also use this drop-down list. So this is great information here. No matter where you live, you can just move around the map or use the drop down to get specific resources for your state where you live. So you can even click on Guam, Hawaii, District of Columbia. So we're so glad that our union and our federation, the American Federation of Labor and Congress of Industrial Organizations, has these resources available along with our resources on goiam.org. We're so glad that we have our own IAM EAP program. So you don't just have to deal with a company EAP program. You can deal with our union because EAP is here for you, the Machinists Union. The national helpline is 301-335-0735. That's 301-335-0735. We invite you to continue joining the conversation right here on this video, no matter which social media platform you're watching. Let us know not only what you think about what we've talked about, but how you're doing. The IAM has some good news now for you. We're pleased to announce the 2020 scholarship winners. An impartial committee of educators selected 16 recipients from throughout North America. We congratulate the winners and thank all of those who participated in the competition along with the review committee. And as you see, you can see all of the recipients at goiam.org. I know the families are proud of them. We're proud of them too. And we're so glad that this is part of our community service that we can provide these scholarships. So good luck to everyone there. I know they're dealing with a lot, but continuing their education is so important, and we'll all get through this COVID-19 pandemic together and everything that's going on right now. Well, we have a quick look at our calendar now for you. The deadline for the IAM's photo contest has been extended to July 1st. So you have less than a month to get your best photos in. We know a lot of you are talented out there, so do what you can. And the International Ladies Garment Workers Union, ILGWU, was formed June 3rd, 1900. At its founding convention, delegates represented about 2,000 members, and it was one of the first unions in the United States to have a mostly women's membership. Now, we have a photo from the March on Washington there that you see, the black and white photo. It was for jobs and freedom in 1963. The ILGWU crew. It grew to become one of the largest unions in the United States with 450,000 members at its peak in 1969. It merged with the Amalgamated Clothing and Textile Workers Union in 1995 to form the Union of Needle Trades, Industrial, and Textile Employees, also known as UNITE. We thank Voices of Labor for that information. And on June 4th, 1956, the AFL-CIO opened the doors on its new building within view of the White House on 16th Street in Washington, D.C. Now, this is the same building that was vandalized and set on fire Sunday night. So this is the way the building's supposed to look like. It will look like that again. The AFL-CIO, we're still fighting for all union members. The Machinists Union is part of that delegation, and we're very proud to be part of that delegation. So we're going to leave you now with two tweets. One is going to come from the AFL-CIO to show you how strong we all are. And that tweet says, "In this House, we will continue to fight for economic, social, and racial justice with every fiber of our being." And from the Machinists Union, "At our core, labor unions stand for solidarity. We stand for the voice for the voiceless. We remain united in our pursuit of democracy, justice, and human rights on and off the job. Well, that's it for Activate Live today. Join us next Wednesday on the same social media platform at 3 p.m. Eastern, noon Pacific, as we continue our mental health series, thanks to the Employee Assistance Program. The IAM is here for you. And don't forget to fill out the census so we make sure labor counts. Hang in there.